after news on 770 CHQR. Oh, I have so much more to say on this, friends. Let me just start by putting this one out there. I have a doc, as you know, who I run a number of different ideas and studies and medical reports by just to see what's real, what's not, what's junk, what's promising. And listen, one of the things he sent me was this. It was a study in South Africa. All back in May, so it's a couple months old right now. Do you remember that Justice Center for Constitutional Freedoms has been asking the government whether they've done any modeling on the loss of life as a result of COVID-19 lockdown? So yes, we know there's a loss of life associated with those who get hospitalized and who go into ICU and who die of COVID. That's one thing to quantify. They quantify the consequence of lockdown. What happened? What, like, when we talk about deaths of despair, when you look at British Columbia, 175 deaths from fentanyl overdose last month. That's more than the entire amount of people who died of COVID in 1 month. It's the highest.
I used to do drugs. I still do, but I used to too.
Suicides. We haven't even really. We don't really report on suicides very often in the media, and part of that is that we don't want any copycat type of activities. The number of people who, like this 73-year-old who went off his rocker after he was told that he had to wear a mask and ultimately had an altercation with the police and got killed. Like all of these kinds of things get factored into this model. But in addition, we know that long-term unemployment or suppressed financial ability to earn also has long-term health consequences.
I'm really sorry, but I have to let you go. And it's purely budgetary. It's not personal.
I'm gonna kill myself!
Wow.
I'm going to kill myself, and it's your fault!
And so they have gone through and quantified all of this. Let me see if I can tell you their methodology. The model excludes, so what is it? Assumptions of the model. The mortality impact on the population as a result of reducing impacts caused by the lockdown. The likely number of COVID deaths. For this model, we rely on existing models, and the likely additional loss of life due to hospital overcapacity. So given how sensitive the results are, they say the model excludes the following impacts of the lockdown. It says they don't talk about the variance within age group, non-income related changes. So they don't even quantify actually the obvious ones like delayed cancer diagnosis during lockdown, lower vaccination adherence. We're hearing all kinds of kids aren't getting their vaccines for other dreaded diseases, lower road deaths and murders. That would go the other way. Lower diagnosis of other treatable diseases, including tuberculosis, impact on mortality from mental health deterioration as a result of the lockdown. So they basically are kind of narrow as I look at this. They're really just looking at the economic costs. So here's what they have. Harm from lockdown. Lockdown has caused a sharp contraction in production and exchange in the economic system, some of which will likely only recover over years rather than weeks or months. The temporary and permanent aspect of that contraction have an impact on the ability of millions of people to make a living. Reduced income has long been known to cause a material decrease in life expectancy. We deploy methods from the insurance industry and poverty studies to estimate this decrease. And as I've already mentioned, I think this is a conservative estimate because they throw out a bunch of additional measures that they could put in place. This decrease in life expectancy is then used to calculate the years of life lost due to the economic impact of lockdown. And then they also have the years of life lost as a result of COVID, or years of life saved, I guess. So years of lives saved by lockdown, because you have to do the benefits versus the cost, are somewhere between 25,000 and 45,000. So if you've got a person who would have died at 70 and they end up living to 90, that's 20 years of life saved. That's how they do the calculation. So as much as let's go to the far end, as much as 445,000 years of life saved by the lockdown. The conservative estimate for the years of life lost as a result of the long-term decline in economic ability to earn, 14 million years of life lost over the entire lifetime associated with people who are suffering the effects of the lockdown and the inability to get back to any kind of normal. That's a pretty remarkable difference. Yes, of course, we have to do what we can to make sure that we're saving lives, but my goodness, no one is calculating this for Canada or for Alberta. How many people are going to end up seeing this kind of decline in their ability to live out a long life as a result of what we are doing today? You see, this is not just academic. This is not just about dollars. This is about saving lives on the other end. And because it's going to be a silent killer, we're never going to see this quantified. That's why I wanted to share this with you, because they decided to quantify it in South Africa. I don't know if it's made any difference on the public policy decisions, but when you permanently suppress a person's ability to take care of themselves financially and take care of their families financially, it has a massive impact on poverty rates and ultimately life expectancy. And that is well understood in a variety of studies. That's why you've got a lot of doctors talking about the need for more of a balance.
So I decided to do some searching, and I found this paper that Danielle Smith is citing, written by this Panda Group, and it's called Quantifying Years of Lost Life in South Africa Due to COVID-19. And I was wondering about this Panda Group. I've never heard of it. I don't think it's any sort of medical journal or renowned medical group. So let's look at their website. Well, it turns out that they created a Twitter account for this pandemics data and analytics Panda Group in South Africa, May 2020. That seems like an interesting date. And in terms of the reports, these are the grand total of all the reports that they've published. Most of them seems to be just news articles. There's about 6 or 7 of them. And this Quantifying Years of Lost Life report is the second one they published in May 11th. So they created a Twitter account and published a report, maybe on the same day, or it's just ridiculous. And then in their team listing, they have their pandas. You know, one of these pandas, his name is Nick Hudson. He's an actuary. Doesn't really sound like a medical doctor. Let's see. Nick has extensive experience in the financial sector and is a fellow of the Institute and Faculty of Actuaries. Spent a decade at RMB Ventures, 4 years at Stern and Stewart & Co. Yeah, I'm not sure what this says about medical science or infectious disease. So let's keep going. Oh, he wants to provide decision makers calculated data on the virus's cost on South African livelihoods. And then we have Peter Castleton, an actuary. Oh, we got another actuary. See, the thing is, you can't just have one actuary. You need at least 2, right? So let's keep going. Oh, they still got more people. They got Shane Cridge. I don't know. He's a lawyer. His name's Shane, spelled with a Y. Has a decade of experience as a corporate lawyer in Europe and has spent the last 9 years practicing in South Africa. He is currently a director in the corporate law department of Worksman's Attorneys. Diverse range of cases. Interesting. Major corporate restructurings, saving butterflies from extinction, assisting victims of police torture, and setting a well-known online startup. Online startups. Maybe this is the startup. This could be it. And then we have Ian McCorian, a big data analyst. See, the thing about big data analysts is you don't want small data analysts. There's no jobs, and don't do small data. So Ian is currently the managing director of Silver Fox Consulting. And you know, look at him. He is a silver fox, isn't he? A firm specializing in data and analytics to inform strategy. Currently residing in the Big Smoke, but escaping wherever possible to indulge in twitching. I don't know what. I'm not sure. I'm not sure what that means. Now we have Russell, a self-professed Austrian economist. He's the managing director of ETM Macro Advisors, an investment advisory firm based in Cape Town. Interesting. Co-author of When Money Destroys Nations, a book about hyperinflation. Interesting. I might have to read that. Ooh, We have a doctor now. We got a doctor in the house. Jonathan Witt is a medical doctor, speaker, and co-founder of the Renegade Report. All right. Okay. So, okay, let's keep going. We got Trevor Neal, senior data scientist in the online casino industry. Okay. Uncanny knack for numbers and his keen interest in machine learning. Fraud modeling and problem solving. Interesting. And then we got Pete. Is that pronounced Pete? Sure. CEO of Bulk SMS. Oh, is SMS? I guess it's still a thing. And founder of Parents Corner. Study engineering. Spent the past 2 decades running communications and social responsibility platforms such as Bulk SMS and Parents Corner. Interests include science, religion, gene culture, evolution, and epistemology. Interesting. There's also these guys. So Vincent, managing director at Differential Capital. Vincent is a financial services professional with close to 15 years experience, primarily in the investments and insurance sectors. As an equity research analyst during this time, he's highly rated, top 3 in the Financial Mail rankings for research in banks, real estate, and general financial sectors. Vincent's current area of expertise are in the blending traditional fundamental analysis with machine learning techniques. Wow. Miguel, chief data scientist. So the other data scientist is a big data scientist. This chief data scientist, which is typically bigger than big data scientists. Miguel has a PhD in statistics and founded the Master's Specialization in Data Science at UCT. He's a chief data scientist at Differential Capital. Oh, Differential Capital. He has vast experience in statistical modeling, particularly using statistical learning techniques. He still supervises postgraduate students at UCT. I don't know if that's a personal or professional task. And then there's David Carmen, medical doctor. He's a medical doctor. He's a Bachelor of Science in Microbiology and Biochemistry and an MBCHB. He's worked extensively with tuberculosis and HIV in the 1990s and has 20 years experience of building secure Linux-based systems that capture and assimilate health data from any resource or machine into comprehensive patient records with mobile web interfaces for use in clinical care facility management, specifically in remote and underserviced areas. When real data is absent, he prefers reverting to basic science over conjuring up lots of numbers. So he builds a Linux system to capture and assimilate your health data, kind of like the Borg, and then gives it back to you with like a mobile web interface. I don't know if that's a web page, maybe it's an iOS app. The thing is, it's like your data and it's on a phone, so it's special. Okay, let's go. Oh, we got Rowan Berger, an actuary. Oh, we needed another actuary. Um, I think we got at least 3 now. I think we're good, but we could, 3 or 4. We could have more, right? He's involved in the policy formation and a regular participant and commentator within the retirement savings environment. That's what we need with coronavirus. When all these retired people are dying, we're just like, what do we do with their savings? Oh, and this is that Renegade Report that I heard this doctor's involved in. Political correctness is becoming pervasive in our society and our daily discourse. Yeah, I mean, like, I'm political and I'm correct. One simply cannot have balanced, nuanced debates about subjects like race, gender, and every topical subject in between without them being protected by non-existent and anti-liberal safe spaces. The Renegade Report is a show where we speak freely and discuss issues openly. Topics will be discussed through the lenses of economics, philosophy, history, and sociology. There will be no sacred cows. It's like, you gotta, yeah, You get a bunch of cows and they're sacred. It's awful. It's an antidote to the cultural censorious norm that debate has descended into. I mean, every time I go out, every time I go outside to the shop, I'm just thinking these norms, they're just awful. Oh, and he's got a picture. Well known for his Twitter antics, Jonathan Witt is a doctor who has become progressively more cynical and annoyed with society. See, this is the thing. This is what we want. Doctors that are more cynical and annoyed. That's what I want. I want all my coronavirus news coming from doctors that are cynical and annoyed. This is what I needed. Jonathan is never afraid to express his opinion on matters even and most, especially when they may not be the popular view. Oh, he's just brave, just brave. Oh, and his buddy Roman is a fierce advocate of individualism and anarchism. He's made a name for himself as a vicious Twitter troll and describes himself as only being interested in good arguments, with scant regard for experiences, moral relativism, or faulty logic. Feelings have little to no bearing in his discourse. Yeah, like, I mean, who cares about anyone's feelings? It's just a pandemic. Like, feelings are kind of shit. And then the introduction of this report. Let's get into the report. Yes. Before we confront the cold hard logic of actuarial mathematics, I mean, we got like 4 of these guys, right? You better do some math. It is worth pointing out that any life loss is a tragedy for all involved. You know, we're gonna put your life into a calculator, but we're gonna feel bad about it. And then this sentence on the bottom is great. Throughout, by lockdown, we mean the highly restrictive form of the phenomenon that is in place in South Africa, including its level 4 and 3 forms. So I don't know what's going on in South Africa, so I decided to look it up in Wikipedia as to what they meant by level 4 lockdown. So it turns out what a level 4 lockdown in South Africa means is, well, it means for one, a liquor ban, a tobacco sales ban, a curfew, movement restrictions between provinces, municipalities, and districts, a closure of borders, and a total ban of gatherings, unless you're at your job, I guess, or buying essential goods and services. So all of these things have nothing to do with what we're doing in the United States and Canada, but you know, Danielle Smith having a radio show in Alberta, found this to be the most relevant study she could find. And here we go in the study again. We also address the salient questions of HIV and tuberculosis. Our sense. So they wrote this in May, right? But they had a good sense about what HIV was all about. So that's what we want. Our sense from the cynical doctor, our sense is that neither will present as substantial comorbidities, so that our second assertion regarding deaths being skewed to the old and infirm is not threatened. So we sense that we're like right about this stuff. Okay. Implicit in this perspective are the following observations. Tuberculosis is not showing up as a risk factor. I mean, maybe they're looking or maybe they're not. I mean, it's not showing up on their desk and they have the calculator. It is noteworthy that Indonesia, which has a more advanced epidemic and high tuberculosis prevalence, is not exhibiting high TB-related fatalities either. I mean, it's May. I mean, but it's not too early. Just hit publish and go back onto your Renegade podcast. Anyways, right? So HIV, the second point they make, managed or unmanaged, is not showing up as a risk factor. In relation to our population of people who are very old and very sick, numbering in hundreds of thousands, our unmanaged population of HIV cases is in the range of 1.5 million to 3 million. If these represented highly at-risk people, they would be representing a majority of deaths by now, which they aren't. Indeed, it appears that the rate of prevalence of HIV among South Africa's deaths is below the population prevalence rate, although it needs to be noted we are dealing with very small samples. So our sample size is absolute shit, but this doesn't stop us from running our mouths, right? So this shouldn't, like, we're cynical and annoyed anyways. Let's just go. Let's go. And this is another snippet from the report about how the lockdowns and other things have meant tragedy for European car sales. I mean, what we need to do is lift the lockdown and let grandma die. And the first thing people are going to do is they're going to go out and buy a Volkswagen Jetta, because that's what we really all need, is a Jetta. That's like that's the tip of the hierarchy of human needs, is a Jetta. And in conclusion, their conclusion is that coronavirus is going to cost about 500,000 years of lost life, and then the lockdown benefits provided some increment, and then but the lockdown causes a loss of, through their fancy actuarial math, of 14 million years of lost life. I don't believe it, but I lost my graphing calculator on the couch, so I'm not going to double check it. So what these authors are saying is 500,000 years is definitely gone, and then they say without lockdown, that coronavirus, by their own numbers, gets 5 to 90% worse. And the nonsense in this is these authors do not actually know what human behavior is going to be when coronavirus gets twice as bad. So if coronavirus gets 90% worse, are you going to go to the mall? Is everyone going to be in the West Edmonton Mall hanging out with coronavirus deaths being double, with deaths in Alberta being what they are in Arizona and Florida? Maybe. I mean, I won't be there, but people might. Now let's recap all of Danielle's, or at least most of Danielle Smith's recent screw-ups. This pandemic analysis group that she cited was born yesterday, which is extremely suspicious. There's many medical organizations that have been around for years that she does not bother to cite. This study was not written by relevant experts, as we've gone over. They're mostly a bunch of finance guys and programmers that can read a little bit, read a table of data, but they have not provided any relevant experience into their conclusions. The study was not in any kind of medical journal or any kind of scientific journal, and there is no peer review or inspection of methodologies. The study says bold, difficult to prove things about HIV and tuberculosis with early data and small sample sizes. So I think it's not responsible for her radio show to be citing these things as if they are conclusive at this point. The study was speaking to a type of lockdown that does not exist in the United States or Canada. As I've gone over, the South Africa level 4 lockdown that imposes curfews, movement restrictions, bans on alcohol sales, and other various restrictions is not something that's actually happening in Alberta or Canada or the United States at this point. So all this analysis, economic conclusions that they arrive at, it doesn't map to the experience that everyone has in North America. And then without evidence, Danielle is creating a link between Vancouver's lockdown and overdose deaths, which is completely unfounded and unproven. There's no evidence to suggest that people suddenly started taking fentanyl in February or April. Without evidence, Danielle has created a link between deaths of despair and the lockdown. There's no evidence to suggest that the suicide rate is spiking or anywhere in the world, or at least is not recited in this study. Without evidence, Danielle creates a link between lockdown repeal and economic recovery. So the study is not modeling human behavior, or there is no behavioral economics basis to say that you just repeal restrictions and then the economy recovers. Has no basis in reality. So let's, for a specific example, take this hot dog vendor that might have worked in a baseball stadium, right? So we can say with the lockdown for the 2020 season, the baseball season is not happening. And by the end of October of 2020, all projections are saying there's going to be 200,000 dead in the United States. Now, let's say this continues at a very steady pace, right? And then the 2021 season is also canceled, right? So now Danielle would say that this person would be person would be despairing, right? But then let's say in the 2022 we have a vaccine or mitigation strategy, and then the people can visit stadiums, professional sports teams can operate, right? So this is somehow insufficient, right? So let's get into what the freedom model might look like, right? So 2020 is done with 200,000 deaths projected into the end of October. Now, let's say that we open up schools and office parks and presumably stadiums by the next 2021 season. We can assume that there would be an increase in deaths from instead of 400,000 or lower. We would expect, I don't know, 500,000, 1 million. Who knows what people are going to do, and also who knows if people are going to show up. If COVID deaths double over the next 6 months, who's going to show up to watch baseball and buy a hot dog from this guy, right? This guy's job is potentially done for, even if you go through the motions of pretending to reopen, right? Reopening doesn't change human behavior, or what's going to change human behavior is perceived risk, right? So if you don't take the lockdown seriously and you don't lower the perceived risk, then you will get bad numbers. The economy will suffer. But again, no one is given, no model is presented as to how many deaths Danielle is willing to see in order to say Major League Baseball or the NFL or NBA should be reopening. Now let's talk about this guy named Tate Reeves. He is currently the governor of Mississippi, and he's a member of the Republican Party. And and you would think, his name's Tate, so it actually turns out that he has a career in banking and finance in Jackson, Mississippi. And you might think that he is going to concur with the authors of the Panda study because he's a CFA, and he might be one of those math guys that has read the data in the same way, and maybe he's calculated the number of years lost in the same way. Well, it turns out he does a great job of debunking herd immunity. So here's what he says. Let's talk about herd immunity. I've listened to some people argue that the rapid spread of cases is a good thing, and we need to reach herd immunity in Mississippi and elsewhere to survive. I'm not a health expert by any means, but I am a math guy and I have thoughts. So this is something that Danielle Smith would probably go on. He says the experts would say we need 70-80% of the population to get COVID-19 to achieve herd immunity. Let's assume they're wrong and we only need 40%. So then he's doing the numbers in Mississippi. In Mississippi, our population is 3 million. We have about 36,000 cases so far. And he's calculated that they need 1.2 million infections to achieve a hypothetical 40% threshold, right? And then he gets into the numbers of what they're seeing right now. Their worst day of new cases, they had 1,000 new cases. And then to get 40% infections, they would need 3,000 cases every day for a full year, right? So they would need to triple their worst day every day for a year. So he is saying, right, that their worst day needs to get 3 times worse, right, to hit that 40% number. And that 40% number is conservative estimate. And he continues, I'm not one of those guys that immediately dismisses the idea that challenges any ideas that challenge expert status quo talking points. I'm pretty skeptical by nature. That's healthy. But herd immunity is not anything like a realistic solution in the short or midterm. I wish it was. And then he continues, unless you're willing to go without hospitals after a car wreck or heart attack, we need a different approach. Right now, despite mixed messages at the beginning, it seems like masks are the best bet. They're a hell of a lot better than widespread shutdowns. Please wear one. Seems cut and dry. But somehow this is a message that is not making it onto radio shows and conservative talking heads in Canada, even though this is a Republican governor of Mississippi. He's probably got more conservative credentials than everyone in Alberta
today. So let me just get to a couple of them here. I want to put this out there because I'm having these debates with people who continue to call me selfish because although I don't think it's selfish on masks, I think I'm being very reasonable and moderate by saying, if I'm sick, yes, guarantee you I'll wear a mask. I'm persuaded by that it's to prevent me from breathing germs on you and passing something off to you if I'm sick. If I'm healthy, no, I don't want to wear a mask. Maybe the idea is that we should all have an at-home thermometer, and you take your temperature at the beginning of the day, and if you're over a certain temperature, then you put your mask on. Maybe that's where we get to some level of agreement, and I would trust my fellow citizens that they would do that they wouldn't go around coughing and sneezing and breathing all over me. That would be number one. But number two, I accept that when you get within 2 meters of people, you should mask up if you're going to be interacting with them in any way, as opposed to just walking past them down an aisle. I just don't think that there's enough evidence to suggest that that's causing massive transmission. Otherwise, we would have had massive transmission because everybody's been doing that from the beginning. So don't misunderstand me. I'm not saying no masks under any circumstances. I'm saying if you're sick or think you might be sick, yes, wear one. And if you're going to be within that 2 meter distance, yes, wear one. Because listen to this argument that I'm hearing from a hospital worker. I work at a hospital in Calgary. I have no patient contact, and I'm not required to wear a mask unless I cannot maintain physical distance with my coworkers. On my breaks, I go outside for walks, and when I enter the hospital, no mask. Yet every visitor coming in is required to put a mask on. Doesn't seem right to me. Same thing when you go to a grocery store. They recommend wearing masks, yet the majority of staff there are not wearing one. Mixed messages. Absolutely. Just give me something that sounds credible and real as opposed to just making it up as you go along. What sounds credible and real. Wear a mask if you're sick. And if you get within 2 meters of somebody for an extended period of time, also mask up. I don't know why we can't have that kind of clarity in any case.
Now let's talk about Danielle Smith's thermometer idea, right? So what she would have us do is take our temperature, before we go out and decide for ourselves whether we would wear a mask. But then she also says that if you're within 2 meters, you should wear a mask. So she's kind of on board with the current masking or universal masking policies, but she doesn't seem to put 2 and 2 together. I don't know what the mental deficiency is here, that what she's proposing is exactly that public health officials are putting forward. But let's take it for granted that she thinks that we can take our temperature at home, buy a $10 device, and just wait a couple seconds, take our own temperature, and then make decisions for ourselves as to whether we should mask up or whatever, right? So it begs the question, with the outbreaks in Calgary, over the weekend or over this week, we've had 105 new cases, right? One at a few restaurants in Calgary. So the question is, who at the Cactus Club did not take their temperature correctly? Who at the Cactus Club did not inspect their own symptoms? Does Danielle Smith actually believe that someone felt sick, right? Had a cough, had a fever, and then went to the Cactus Club anyways? Is that something that she legitimately believes? That's what it appears so, right? So her solution, I suppose, is people, instead of having a mask in their pocket or purse, should just have this thermometer that they keep by the door, and then if they should self-diagnose, and then everyone should just take it for granted that their self-diagnosis is correct. Again, I'm not sure what the heck she's talking about. Maybe she can elaborate. And when she talks about this health professional that is not required to mask, if you read the policy from Alberta Health Services, it is explained from the get-go in very specific terms, right? Point 1A, healthcare workers should wear a surgical/procedure mask continuously at all times in all areas of the workplace if they're involved in direct patient contact or cannot maintain adequate social distancing from patients or coworkers, right? So the primary solution is social distancing. Exactly, it's always been like that. And then the policy is the worker should wear a mask when social distancing is not possible from patients and coworkers. The obvious exception here is, of course, if this hypothetical healthcare worker has his or her own office, right, an executive bathroom in some wing of an institution that no one goes to, sure, they don't need to wear a mask. No one has ever asked that person to mask up while they're sitting in a room all by themselves. So I'm not sure who could know who Danielle Smith is even arguing with, right? So it's just absurd. And every public health professional in Alberta and elsewhere, every place is saying to wear a mask, right? Universal masking. So just wear a damn mask. It's not a big deal. If you're in a hallway, shared space, grocery store, supermarket, gas station, just wear a mask, right? Elevator, wear a mask. If you're on a bus, wear a mask. If you're on a train, wear a mask. It's not difficult. No one's asking you to wear a mask while you're on your bike. No one's asking you to wear a mask when you're sitting in your basement recording a radio show. Just address what people are asking for, which is you're in a public situation, you can't social distance, you put the mask on, and then you shut up about it. It's not that difficult. Have a good day.
But I don't believe that anybody should tell me what the hell I have to do, pardon my grammar anyway. That's dictating. We've got enough of that as it is. I don't need some sucker to tell me how to drive.
With only a week to go before the law takes effect, it's obvious a lot of people are still fighting seatbelts. Joe Miller, the man who doesn't like being told what to do, says he's going to ask his doctor for a medical certificate so he won't have to wear one. Alberta's transportation minister used to be against wearing a seatbelt, but he reconsidered after some people were killed on the highway he drives from Edmonton to Peace River.
To that, and when I sat down with my wife at that time and talked about it, we decided the odds were mounting up and I should start to wear it. So,
Adair's department has a TV commercial promoting the use of belts.
Your driver put on seat belts today.
Sure did.
But the government chose the soft sell approach. Only 28% of Alberta drivers are buckling up now. If you're one of the 72% who aren't, you'll need a good reason after July 1st. You don't need a seatbelt if you're driving in reverse, if no belts were installed at the factory, if you're driving a taxi with a passenger on board. And you don't need to wear one if your doctor gives you a medical certificate saying you have health problems the belt would irritate. Hadley and other motorists will soon see these new orange signs beside the streets and highways they drive. If they don't buckle up, the fine's $25. Bill Lang, CBC News, Edmonton.